Hi, my name is Pete Ravenhill. I'm an equine vet and director at B&W Equine Vets. My clinical caseload and my special clinical interest is equine dentistry. I'd like to answer some of the commonly asked questions which I encounter every day when I'm seeing horses and owners out on the road. Okay, so this is a very common question that I get asked, is why do I have to get my horse's teeth examined and rasped when in the wild horses wouldn't be having any dental treatment at all? Now, the main reason that you've got to go back to is looking at the anatomy of horses' teeth. And when we're talking about treatments and rasping, we're generally concentrating on the cheek teeth of the horse, which on this upper skull are the 6 cheek teeth which act together as a grinding unit. Now, the vitally important difference is that in horses they have these hypsodont cheek teeth, which are really cleverly designed so that they basically keep on erupting throughout the life of the horse. Now, they don't keep on growing like in other species like a rabbit, but they keep on erupting and they're worn away at the grinding surface at the same rate as they erupt from the bony sockets. As a result of this, due to the sort of alignment of the upper and lower jaws in the horse, we naturally get very sharp enamel points developing on the outside of the upper cheek teeth and on the inside of the lower cheek teeth. Now, in the wild horse, if you looked at wild horses and wild zebras, we would find that they would have really sharp cheek teeth, they have really sharp points on their cheek teeth. Now, the main difference is obviously in those horses, we're not trying to actually put a bridle on them, put a bit in their mouth, and we're not bringing these sharp enamel points into play. So with our domesticated and riding horses, basically we are pulling the cheeks down onto these sharp points, or the bit is actually pushing the soft tissues towards these sharp points. So that's a massive difference just in terms of comfort of the horse. The other thing is obviously in wild horses, they are roaming the plains, chewing really coarse vegetation and taking in silicates and abrasive materials into their mouth 24 hours a day. And with our domesticated horses, we put them into lush paddocks, we put them into stables for many hours during the day, and we give them, you know, shorter feeds and less forage. So another really vital question is, why do we have to have regular 6-monthly or annual checkups on our horse's teeth? Why don't we just wait for clinical signs to tell us that there may be a problem? The vital thing here is that the horse is evolved as a prey animal. Therefore, the horse never wants to be the one that shows the predator, such as a lion, that horse has got toothache, because then the predator will single out that animal and take that one down. So what we find in our domesticated horses is that there is a real delay in expressing dental pain. Therefore, if we wait for horses to show actual signs of dental disease, i.e. dropping food, losing weight, and other factors, then often we're already quite a way down the line in the sort of pathological process. So it's better to actually preempt that and see what's going on. My take-home message is that routine equine dentistry is an essential part of any preventative healthcare plan for any horse, alongside farriery, back checks, vaccination, lameness checks, and worming. Dentistry is vitally important whether you have a pleasure horse or a competition horse or a brood mare, to optimize its health and its performance. For more information on the B&W Digital Dental Clinic, please look on our website. You'll see the details on the information below. Like us on Facebook and follow us on Twitter, and subscribe to our channel.